Good evening, friends. We are back with yet another episode of BMC Global Live AL-HILAL Health World, Nothing But Lifestyle. I'm Anupama Menon. Your health is our concern. In this talk show Health World, we have expert doctors from various fields providing valuable information to all of you to assist you all on your journey towards good health. Good oral health is an essential and important part of one's overall health and well-being. In fact, the dentists often say that when they look into a person's mouth, they get a good feel and sense of the overall health of that individual. Poor oral health can lead to a lot of other health complications like cardiovascular diseases, cancer, and even diabetes. Unfortunately, many of us tend to take oral health very lightly. For us, it's just about cavities or maybe bleeding gums. But it's very important that we are aware of the risks of poor oral health and how it can negatively impact our general physical well-being. So to throw more light on the topic of oral health and well-being, today we're delighted to have with us Dr. Jibumol Rafique. She's specialist dentist from AL-HILAL Hospital, Salmabad, and she comes with an experience of over 20 years in the field of dentistry. So let's go over to her and find out more about oral health. Doctor, thank you for joining us today. How are you doing?
All fine. Thank you so much, Anupama.
Welcome to the show, Doctor.
Thank you.
So can we begin by discussing what exactly is good oral health? How would you define good oral health?
In general, people believe that good oral health is all about healthy teeth, that is shining or well-aligned teeth, but it's much more than that. It also refers to a complete orofacial system that allows us to speak, to chew, and to smile.
So why is good oral health so important? Because as I mentioned earlier, it's supposed to be an indicator of a person's general health. So why do you think it's so important to maintain good oral health?
We all know that good oral health has got some impact on the way we live. Obviously, it will boost our confidence also, but we hardly know how it is connected to our overall well-being. Actually, the mouth is a reflection to your body. In many systemic diseases, we could find the first signs and symptoms in oral cavity. So these both are interconnected.
Okay, so basically I think mouth is a window to the rest of your body.
Yes, exactly.
It actually reflects what your body is going through. It can be indicative of other issues as well. So what is the necessity of maintaining oral hygiene?
The gum disease, that is a periodontal disease, has got associated with some sort of systemic diseases such as diabetes and cardiac issues. For instance, the mouth has got plenty of bacteria, both good as well as bad. So in case of bad oral hygiene, this bacteria can multiply, it increases in size, increases in number, and it can travel to the bloodstream and even causes some clogging of arteries. It can lead to the cardiac issues. And in diabetes, people are prone to gum diseases. So if they do not maintain the good oral hygiene, they will have a more chance to get even severe diseases like gingival enlargement and bleeding, and can even have increased amount of bone loss in shorter period of time. And in some conditions like pregnancy, where we find change in hormonal imbalance, they affect the appearance of the gingiva and the texture. So all these situations, it is necessary to maintain a good oral hygiene, because it is all preventable in early stages.
Okay, so bacteria buildup can lead to
a lot of issues. Yes, it can cause us bleeding, soreness,
bleeding, and even cardiovascular.
Yes. So all are connected in between.
So major health complications. So I think this is an eye-opener for all the viewers
out
there.
It is necessary. Yeah, it is necessary to give awareness regarding all this, because people mostly go to the dentist when the pain starts.
Yes, we wait for an issue to crop up to go to the dentist. So what are the most common oral diseases that you've observed?
The most common is dental caries, that is the cavity.
Cavities.
It starts as a small tiny spot on the enamel, that is the outer surface of the tooth. It is asymptomatic. So at this stage, it is easy to do treatment such as fillings, but when it goes beyond, when it goes down to the tooth and reaches the pulp, the innermost layer of the tooth, it starts paining, and the treatment also changes. It will be a little more complicated, like root canal. Root canal treatment is to eliminate the bacteria from the root and to prevent the reinfection. And the second is gingivitis. That is a common gum infection. Mostly healthy gum is coral pink or like pink color, which is more firm and resilient. So if there is more plaque accumulation over the teeth, it disturbs the teeth and irritates the gum. So it causes symptoms like gum bleeding and even pain while chewing. This is totally reversible. It can be treated with the simple procedures like scaling and polishing. But when we ignore this stage, this deposit can go deep into the bone. It affects the periodontium, which is a structure that surrounds the tooth. So when it gets into the periodontium, it affects even loosening of the teeth. So this stage is little more complicated than gingivitis.
So what are the common symptoms of periodontal diseases?
Periodontal diseases can cause bleeding, soreness, and bad breath, bad taste in the mouth also, and even causes the loosening of the teeth. So it is little more important to take care of the teeth.
Okay, so these are the symptoms to look out for: bad breath and bleeding of the gums and all that. And I think as soon as someone detects this, it's better not to delay it and then go and visit a dentist immediately. Yes. And caries also, you said, if it's detected at the early stage,
it can be
easily taken care of, and even a root canal maybe can be avoided. You also spoke about gingivitis. So if you could just throw some light on what exactly it is and what are the symptoms and what is it that a patient should be aware of when they have gingivitis?
Poor oral hygiene is the main risk factor of gingivitis. In addition, some sort of medication such as antihypertensive or anticonvulsive drugs can also cause gingival enlargement and bleeding. Apart from this, smoking is also one of the significant risk factors for development and progression of gum diseases. And in smoking, there are certain substances in nicotine, chemicals, can decrease the flow of saliva. Saliva is very much important for cleaning and disinfecting the mouth, so it can cause us to dryness and bad breath. It also decreases oxygen flow to the area, and so it makes that area undiagnosed, and because there will be not much bleeding, so it can be undiagnosed for longer period of time. And smokers can also will get affected by ulcerative gingivitis, which is a sort of gum disease, which can lead to bad breath and bad taste also.
So doctor, what are the other oral diseases that affect the health?
There are certain conditions we could find the loss of tooth structure, such as attrition. It is shortening of the tooth. The height of the tooth will become smaller. That is mainly because of night grinding or excessive chewing or biting with hard objects. And next comes erosion. Erosion is also a horizontal tooth wear. That is because of faulty brushing technique. And then comes erosion. Erosion is because of increased acid production or by using more amount of carbonated drinks. These situations can be easily treated by following some rules, such as avoiding carbonated drinks, because taking more acid can cause enamel loss in long time. So we could not find it very fast. It takes some time to find out the problem. So these things can be avoided to maintain a good oral hygiene.
So carbonated drinks has to be avoided at any cost.
Yes, and try to avoid biting hard objects like pen, pencil or anything. This will also cause us wearing away of the teeth.
And also we have to be very careful about the technique of
brushing
also.
It
should
correct,
not be too hard.
Always use soft or medium bristles toothbrush. You can ask your dentist the way how to brush, and always use correct technique. That is very important.
And doctor, I'm sure many of your viewers would like to know this. When is the right age to visit a dentist? Because normally visiting a dentist is not a very pleasant experience, especially for kids. So we keep putting off the visit to the dentist until some issue comes up or the other. But in your opinion, what is the right age for a child or an adult to visit the dentist?
I would say regular checkup is necessary in all age group, even for children. Once the milk tooth are erupted, it is always advisable to visit a dentist, because keeping milk teeth in good condition is as important as permanent teeth. And because early symptoms can be easily treated, and regular checkup can avoid many of the serious problems also.
So as soon as the milk teeth erupt, you think it's advisable to go and see a doctor, and it's very good to maintain the health of the milk teeth, because a lot of parents think that the milk teeth are anyways temporary, so they may not pay much attention to it. So in your opinion, it's very important that they...
It's the same, taking care of milk teeth is very important.
Extremely important. And even for adults, how often do you think a regular routine checkup is required? Every 6 months?
Every 6 months is advisable.
Even if there's no problem?
Yeah, even if there is no problem, it is always advised to visit dentist in every 6 months.
So doctor, it's time to wrap up our episode. So before that, would you like to give any takeaway message for our viewers on how to maintain good oral health and oral hygiene?
So it's always advisable to take care of your oral cavity to prevent many of the serious diseases. So it is good to do brushing 2 times a day with the correct brushing technique, and do flossing daily. Treat the cavities if any, and to treat any malaligned tooth, because in crowded teeth deposits will come more fast and it is difficult to clean up also. And do a regular checkup in every 6 months. And in addition, it is important to take care of selection of food. Avoid snacks or sticky food, and select raw food that helps to clean and prevent the teeth decay.
So thank you so much, doctor, for those valuable inputs on how to maintain good oral health and oral hygiene. I'm sure all of viewers have found this information very useful. Thank you. Appreciate you taking the time out to be with us today. Thank you so much once again.
Thank you so much, Anubama, for being here. Thank you.
So friends, the mouth is an extension of your body. You should pay equal attention to oral hygiene and oral health, as it's linked to a lot of other health issues and complications. Please do pay regular visits to the dentist once in 6 months, as doctor suggested. Brush properly and your dental health will be taken care of. I wish all of you happiness and good health always. Stay smiling till we meet again next time. This is Anupama signing off. Good night and stay safe.